This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Definitely live in studio. It's a beautiful day. It makes me happy. The sun is shining. The flowers are out. So guess what? We're here to give you intimate information on things that should make your heart sing. We'll talk about that in just a second. Give us a call at 888-630-9625. 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've done, the same old repetitively and come up with the same old thing. What? Nothing. Doesn't work. Well, here's an opportunity. Let's see if we can turn that around. Make a difference on your life, basically without drugs and without surgery. That's why we do the program. We have a very interesting program for you today, one that, it's the same thing for guys and women, except we change the title of it. Guys think that they're so buff and strong and say, well, my wife's going through menopause and she's going through perimenopause and she has all these symptoms. Well, guys, guess what? You go through the same thing, and it's called andropause. And we actually set up a program for you so we can talk about that. It's called Uniquely Male. So, ladies, here it is. You can find out why your husbands are so gruff and ugly and jumpy and barking and, they don't want to do anything anymore and, that playfulness is gone. Their mind is kind of shutting down. Their emotions are reactive at best. Forget about their libido and their sexuality. That's gone. And you wonder why. Well, it's called male andropause, and we're going to talk about that. And in studio today to handle the specifics of that, and he will be your presenter, your host this Wednesday evening at the Roselle Center for Healing, our in-house continuing education program, Dr. Matthew Adams.
Hello.
Hello, Dr. Matt.
And I get to be the one to talk about all the ugly and the what all did you say?
The nasty, the ugly, the good and the bad.
And now they're turning the radio off because they're like, I don't want to hear about.
No, that thing. Most guys don't want to step up to the plate, right now. But here's the other side: wives and partners and stuff. They're going to get their male, and they say, "Come here, listen. I want you to listen to the program today."
Well, isn't that why a lot of them come in? Anyway, it's because
they do.
Men are usually in because their wives are encouraging them to come in.
Of course, guys are ostriches. They put their head in the sand and they don't like to look at the facts. And the facts in this situation is that guys don't feel good. They're, and you see all over the marketplace from Fifth Avenue marketing when it comes to drugs, and they're talking about all the Viagras and the Cialis and all the other erectile dysfunction drugs. And the truth of it is that. When you're 60, 70, 80 years old, you shouldn't have the libido of somebody who is 18 or 20. God forbid. There's a story that Jack Welch, who was the creme de la creme of CEOs for General Electric years ago, and a reporter asked him the question, Jack, do you still have the attraction for women that you used to? And he said, thank God, I'd never get anything done. So I think that's part of the process of maturation. We have to get to that place where we can actually think about the work in front of us. But having said that, we have to talk about guys not feeling good and losing muscle mass and their capacity,
yes.
Their mental capacity as well as their sexual capacity and so forth. And it's one of those things that we kind of set aside. We focus on women all the time, but we don't really answer the question about guys. So, Dr. Matt, let's get into the subject a little bit. It's important. This Wednesday evening you're going to be doing that presentation, and it's an important presentation. It's one that we really have to look at and answer questions. So, let's talk about uniquely male. Let's talk about male menopause. Let's talk about that time of life where guys go through and they don't feel good and they hurt and they have back pain and they have all those things. How far-reaching is this?
It's not far-reaching at all, and it's something that develops it kind of develops slowly over time with guys. The guys don't think about it. We think hormones, we think women because they go through cycles, and then all of a sudden they get to a point where they stop making certain hormones. Well, not make them, but then it switches over to adrenal system. So guys, we don't think about that because we're not going through cycles. But at a certain point in age, you stop making your guy hormones. I mean, testosterone starts to decrease. Growth hormone starts to decrease, and it decreases a little bit every year as you go along. And so that's why they don't think about it. They don't think about, I'm going to hit a certain point, boom, I hit andropause. It starts around 30, and then every year your testosterone decreases 1% every year after that.
Yeah, it's kind of ugly. Then you look at the situation where, when you're 15 to 30, we'll use that marker. Guys' testosterones on lab tests sometimes are over 1,000. And when you get later on in the years, sometimes they get as low as 200. And so that's the swimming pool, if you will, the full pool of testosterone availability. But as you said, it links into everything else from growth hormone and testosterone and triggering mechanisms with thyroid, DHEA, and so forth. You've got this whole ball of wax. The problem is not to supplement, but to figure it out. So my question to you is simply this. Does a guy, we talked about a 1% decline. Is that a hard have to, no matter what, can that be changed, and can it be changed without drugs?
I don't think it has to be that way. I have to go back and look at the exact study, see who it was. But the problem is when they do studies like this, they're looking at the average male. But, what kind of lifestyle is the average male in this area living? And you have to look at that, too. Look at the things that they're eating, the things they're around, the things that are affecting their stress, all that stuff, because that's going to influence how quickly it declines. So, I think a lot of men nowadays are declining faster than that 1%. We just break down faster.
Our environmental situation is contributing to it. Our stress factors are contributing to it. And I want to get into that little piece, because when we talk about stress, we're talking about emotions, but we're talking about biochemistry. We're talking about guys putting up with injury over years that they shouldn't have to put up with. And they do it because that's our society. That's the way it happens. But when you combine those three things, now you see a dramatic and rapid decline of guys' capacity.
Yeah, all the systems work together. So one breakdown is going to affect another breakdown, and then before you know it, you're not making that much testosterone. Now you're making more estrogen, which we'll talk about a little bit more, and how that affects testosterone. Now you're running the risk of diabetes and all these other issues, and so you're going in to get your testosterone checked. You're like, my testosterone's low, but then over here you've got your blood pressure, you've got your blood sugar, you got all the other things that they're worried about. But, a guy's not going to worry about that. He just wants to worry about his testosterone. Yeah,
but in the meantime, they're on medications, and the medications are acting as a secondary suppressor of testosterone as well, definitely. So nothing's working. 888-630-9625, that's how you find us here. And this Wednesday evening, the 17th, no, it's the 15th. I'm making this month go by too quickly.
Don't do that.
I know, April the 15th. Dr. Matthew Adams will be your host, your presenter at the Roselle Center for Healing, 7:30 p.m., and he's going to be talking about male menopause, the problems that guys go through that they don't want to look at, and he'll be there really showing you that there are natural ways of making this take place, meaning to reverse the process and actually getting your life back if you're willing to step up to the plate. But Dr. Matt, let's talk a little bit about the triggering mechanisms of this, because the truth of it is, as you said, that if guys don't do something specifically to help themselves, there is a continual and specific decline in hormone across the board.
Yeah, you have something called the HPA axis, the hypothalamus pituitary adrenal, or you can say even the HPG, hypothalamus pituitary gonadal axis. And so you've got a system of communication from your brain in the hypothalamus that receives signal that says, hey, we need some things. The hypothalamus just talks to the pituitary gland and says, hey, pituitary, we need some hormones made. And the pituitary then talks to your thyroid, talks to your adrenal glands, talks to your, testes and says, hey, we need this stuff. So the problem is that other things in the body break down and mess up the communication, one, and then it messes up the receptors for the communication to actually communicate. It's like if your phone line gets cut a little bit, or your Skype message is a little bit shaky and you can't get all the information. So that's what starts taking place.
It's like doing this broadcast. We're sitting here and we could be sending messages out, which we do through the microphone and the airwaves and so forth. But if you don't have a receiver, a receptor that is working well to hear it, it either becomes garbled or absent completely.
Yeah, and so now it's not getting input. Now your body either has a bunch of extra hormones floating around that's not getting anywhere. And then now your body's like, oh, I got plenty of hormone. I guess I don't need to make any more. Well, you don't need to make more. You just actually need to use what you have. Or you're getting signal back says, hey, we need more hormone, but the pituitary gland's just kind of in la-la land because it's not functioning properly.
Okay, let's talk about, you're stepping on, probably about 10 different things here that I know that you're going to cover in detail on Wednesday evening. But let's pick that apart a little bit, because it should get a lot of people's interest at this level. Let's talk about that failure of input to be received from the body organ systems. Okay,
so you've got many studies that if you're having problems with blood sugar, and I'm not even talking about diabetes at that point, I'm talking about like even way before diabetes. If you're eating a lot of carbohydrates, if you're getting tired in the middle of the day.
An insulin-resistant pattern.
Yeah, exactly. That creates a problem or a barrier to where whenever a signal goes from one place to another, it can't actually receive. There's a block because of insulin resistance.
The thing of it is, and most people don't understand, if you do have an insulin resistance problem, you have resistance to other hormones, and that's exactly what we're talking about.
Exactly.
Right now.
So that's the problem. Inflammation. We talk a lot about inflammation on this show because of the terrible things we eat and we're around. If you have inflammation inside, again, you're going to have a block of communication from one area trying to talk to another. So you have these other breakdowns in the body that are taking place, keeping you from doing what you want to do. Blood pressure's another issue that we see. A lot of times with andropause, the symptoms we have, in my opinion, are usually breakdowns somewhere else, and these are symptoms of that breakdown. And so that's why we're not big fans of just going after straight hormone replacement therapy. You need to go find the breakdown.
Got to find the why.
Yeah, exactly.
In studio, Dr. Matthew Adams, your host, your presenter this Wednesday evening, 7:30 p.m., the 15th of April at the Roselle Center for Healing. We're talking about male menopause, also called andropause. Give us a call, 888-630-9625. That's 888-630-9625. That's where we're at here. And how you register for this Wednesday evening's program is you call 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. As always, these are our gift to you. This is a gift to the community. There's no charge, but we do require a reservation. So we'd love to have you. And listen, you have a lot to learn. This is a great way of finding out how to fix certain things in your body. We've got about a minute before we have to take a short break, but what I want to touch upon is this. Does somebody with back pain, can they ultimately end up with dysfunction of the gonadal system?
Yes.
Okay, so
the answer is yes.
So how does that happen?
Okay, so I have 1 minute. All right, so we'll talk about it after. But you have nerves going to the gonadal system. That's going to affect it. If you're in pain, pain causes stress. Stress messes up your that whole system, hypothalamus-adrenal axis that we'll talk about too. So it's affecting it both ways. And so a big problem with back pain.
So, guys, what we're trying to tell you, if you've been in pain, you've got leg pain, back pain, any kind of pain that you've been putting up with for a long time, guess what's going to happen? You're going to shut your hormones down so they don't work because of the high levels of inflammation and the receptors that bring that hormone to action to make it work. We're going to talk about that much more, and obviously this Wednesday evening as well. We're going to take a break. Don't forget, call us here, and we'll see you in a minute.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back, everybody. You're listening to Dr. Tom Roselle Live. We are definitely in studio, 888-630-9625. That's how you find us. My guest today, your presenter this Wednesday evening, Dr. Matthew Adams. He's going to be talking about all those things that guys don't want to talk about. You know, it's called menopause for men.
The things that they Google.
Yes, they Google.
When no
look,
one's watching.
When nobody's watching. Exactly.
That's why all the commercials about Viagra are out there. They're looking. They just don't want to talk about it.
Yeah, they just, it's one of those sank things that they don't want to say anything about, and they do it at nighttime when their wife is in bed, and, it's like that. But, guys, there's a fix. There's a way you can get around this thing. It's not meant to be that way. You're not meant to go into equipment failure, but we're not just talking about that. We're talking about the loss of mental capacity, the ability to have desire to do other things, want to work, to want to achieve, to want to accomplish. It seems to go away, right? So you get in the workplace and you got these fiery young guys that are out there biting at your heels, and they want to take over the workplace, and you're starting to go backwards. You don't have the drive. You don't want to go into combat anymore. You don't want to deal with those things. So let's talk about that back pain that causes some of this stuff.
Yeah, I've got a pretty good example of a patient who came in with sciatic back pain, like real bad, and they were having problems with it. But something else was going on is they were having some performance problems, and so they were not able to, get like the erection that they wanted. This is a young person too, and it was coming from the back pain, because when you're under stress causes you not to have very good blood flow, for one, and whenever you think about, you have something called sympathetic system and the parasympathetic system. The parasympathetic is our calming system, and that's where we get increased blood flow, and that's important for having the initial erection. And sympathetic, the kind of like fight or flight system, that's what kicks in later when you have the whole like ejaculation process. So if somebody is under a lot of stress, whether it's from work stress or pain like this person was having, they're not going to have very good performance. Plus, if it's low back pain, the lumbar spine, those are the nerves that are actually going to that organ system, the gonads,
that increases the blood supply.
Yeah, exactly. So once we help this person get out of pain, they didn't have any problems anymore with that.
Yeah, it's such an obvious situation. I've had patients who come in and guys don't say anything and say, you treat them for back pain. All of a sudden, 6 months later, they say, by the way, hey, doc, could this have any problem on my... I said, yeah. Why didn't you tell me that before? We could have done something. Yeah. But it's a circulatory problem that also has to do with brain function and all of those things.
Yeah.
888-630-9625. My guest in studio, Dr. Matthew Adams. We're talking about male menopause, that thing that's called Andropause. But this Wednesday evening, we're going to present for you specifically for that problem. Uniquely male. Give us a call, 703-698-7117. That's 703-698-7117. Sign up for the class. I promise you we won't tell your wife that you're there. Let's go to the phones. Bernice, how can we help you?
Hi, I have a question about a friend of mine. She's about 80-something, and she was telling me the other day, because I always hear them talking about male prostate and urination, but they never talk about women. She said that she had been urinating a little bit all day long, and I thought, well, I don't know, maybe you're lacking zinc, I don't know. But What can you tell me about that?
We're talking about the same type of thing. It's a hormonal-related type of condition, and there's several things that can be done. You've got to strengthen the muscles, the pelvic muscles, because if they're tenting downwards, then she's not going to be able to hold her urine well. And that can come from the back. It can be a neurological problem. It can be a hormone problem as well. Women need testosterone. They need the estrogens and progesterones. And when those things start dropping down because of weakened adrenal fight-flight, then the problem is going to be as you're describing. When the acupuncture energy isn't moving through the body, the lower portion is not going to hold properly as well. So you have neurological, you have energetic, you have biochemical. You have to look at all those pieces, Bernice, but it can be dealt with. And it's one of those things that you take a patient, you look at their specific condition, what's really going on with them, you fix as many pieces of the puzzle as you possibly can, and take care of that. Bernice,
what kind of doctor?
The kind that we do. Somebody does functional medicine, manual therapist, chiropractor, acupuncturist, a doctor of naturopathic medicine, somebody who does the work that we do from a multidimensional point of view. Bernice, give us a note, and I'm more than happy to discuss it even further with you. Deborah, thank you for calling. How can we help you? Deborah, hello? I think we lost Deborah. Lisa, are you there?
I'm here, doctor. I have a question about ARP, which is Accelerated Recovery Performance. There is a clinic that's opening in Lansdowne here in Loudoun County, and it helps people with osteoarthritis, with chronic pain and hip and knee.
Okay, first of all, the phrase that you're using is their marketing phrase. Okay, it means that what they're looking at is trying to figure out how they can help you to repair whatever it is that your complaint is at a much higher level. I don't know anything about them. I don't know what their approach is or if they deal with drugs or anything else, but if you find out more information, send me a note on email, and I'm more than happy to look it through. But accelerated performance is simply a tag, a moniker that really doesn't mean anything unless you know what's behind it. We have several more calls. We're going to take them, I promise you, and we're going to try to get to as many as we can today. My guest in studio, Dr. Matthew Adams, will be your host, your presenter this Wednesday evening at the Roselle Center for Healing, 7:30 p.m., and he's going to be talking about male menopause, that unspoken thing that happens to too many guys that's not necessarily one of those things you have to put up with.
Nope.
There's a fix to it, and if you're willing to do certain things and make some changes to find out why instead of treating the symptoms of the problem, I promise you can get your life back. There's no reason to limp along and to suffer and to... Don't look at me like that, Dr. Matt. I mean, it's all true. We lose our brains, we lose our capacity, muscle weaknesses, and other things just don't function the way they used to. We're coming up to a break. Don't go away. We have a lot more information, and we want to give you as much as we possibly can. And then I'm going to give you some data at the end of the show today about where I'm going to be this afternoon. Having said that, hold on. We'll be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. We're in studio today. It's a beautiful day outside, and we're glad that you're listening. 888-630-9625. That's how you find us here in studio. And we're talking about a very interesting subject, something that most guys put their heads in the sand about, and it's called male menopause, also called andropause. In studio to help me dig through that weed nest, if you will, Dr. Matthew Adams will be your presenter this Wednesday evening, the 15th, 7:30 p.m. at the Roselle Center for Healing. We'd love to invite you. Please be there. Be our guest. Our in-house programs are there for you. They're always there to give you as much information as we possibly can. Call 703-698-7117. That's 703-698-7117. And tell my staff that you'd like to be there. We require a reservation. It won't cost you a nickel. We just require a reservation. Deborah, thank you. I'm glad you called back.
Yes, my phone was unmuted and I didn't know how to unmute it.
It's okay.
Phone.
Not a problem.
Anyway, I hope you can help me or give me. I live up in Maryland. You can give me briefly. This is the problem. My husband has type 2 diabetes, and it goes in and out. But he's trying to keep it under control by his diet. But he has some neuropathy, and basically for several years he's been unable, he's impotent. He's not able to have sex.
Yep. Very common, unfortunately.
And I want to know, he's in his 60s, but up until the time he had this and it developed, he was just perfectly fine in his 50s.
It stops all at one time because as the levels of inflammation get higher and the communication to the different cells in the body become less receptive, if you will. That's where we get the receptor sites insensitivities. So what has to be done is you got to find out what's going on. It's usually, in his situation, it's going to be due to dietary patterns, injury patterns, and stress to the adrenal system. It's like the straw that breaks the camel's back. You get to that place and all of a sudden it's done.
Yeah, it's just testosterone is going to keep going down. And then you get into a vicious cycle where you're gaining weight, things are slowing down, metabolism slowing down, and then you start producing more estrogen on your own.
Okay, so, I know all that, but I cannot come to this program.
So you want to know what can be done, right?
I want to know. Let me tell you what we did try. He tried wearing a synthetic patch of testosterone, and he couldn't tolerate it.
And plus, it doesn't work.
It doesn't work, and we thought about getting natural hormone replacement, but he didn't want to try it because of the bad experience.
No, he's got to heal his body. You can turn this around.
Yeah.
There are natural herbs that will work. There's lots of them out there. Some that cause the receptors to be more available. Some that will take the free testosterone, not the pool of testosterone, but the testosterone that actually gets to the receptors and make it more biologically available.
Okay.
But as long as he continues to produce the inflammation, which can be from a lot of things, if the adrenal system's not working, he's done. If he's got any kind of neurological entrapment, then it doesn't make any difference how much blood supply you're getting. It's still not going to work. So you have to look at all of those pieces, and it can help. You're in Eldersburg, Maryland, is that correct?
Yes.
Okay.
Is there anybody who is specialized in this area?
Where is that?
That's in Carroll County, Maryland. I mean, I'm
okay,
west of Baltimore, 30 minutes. I'm 20 or 30 minutes north of Columbia.
So here's what I want you to do, Deborah. Send me a note at rosellcare.com, ROSELLECARE.com.
Roselle Care.
Roselle Care. That's our website at the office. They'll send it to me directly.
ROSELLECARE.com.
That is correct. And I will send you a referral.
Okay.
Okay, Deborah.
All right, but there are there things that can reverse this?
Yes, but he's going to have to really want to step up to the plate and do some things that breaking habits and getting treated the way he needs to be treated. The body's a beautifully forgiving machine.
Okay.
And if you do it the right way, it changes a lot of things, but he's got to be willing. It's not, I'll try. There is no try. He's got to step in and get it done.
Yeah, you can't seesaw. You said it comes in and out. You can't seesaw because you have to be all in, and then once you're all in for a while, then the healing process starts taking place. So once you start feeling better, you can't assume that you're better.
Yeah,
that's when the healing process actually starts.
Can you give me can you give me your office number?
Sure, 703-698-7117. 703-698-7117. Deborah, thank you very much. Send me a note. Appreciate it, and we'll send you as much data as we possibly can. Frank, how can we help you, sir? Thank you for holding.
Hi, doctors. I just wanted to get your opinion on what is called bioidentical testosterone for men and women, typically inserted in pellets.
Okay. Matt?
Just what do you think about that?
The pellets, like inserted directly.
Well, let me tell you this much, Frank. If it was me, okay, it wouldn't be happening. Anything that you have to put into the body artificially before you figure out why the system's not working is not okay. So you have two types of testosterone. You have the pool of testosterone that your body should make, and then from that you go into something called free testosterone. That's the conversion from, let's say that you have, and I'm making numbers up obviously, so don't hold me to the numbers. Let's say that you have 500 milligrams of testosterone in a pool that your body's producing. You can have that sit there all day long, but it's not going to work for two things more have to happen. One, it's got to convert in something called free testosterone, which is what gets into the receptors that need to have that testosterone, and then it has to be available to that receptor. That means that the inflammation can't be there. So you have to get rid of the inflammation and do that. Now, if you're producing enough testosterone on your own, then the question becomes, why isn't it converting or why is it not getting into the system? So you can do that. But in my body, there's not going to be any artificial anything going in. There's a lot of herbs that will help support the system, but you have to make sure what you do first is find out, what you're actually trying to do. Sometimes it's something as easy as taking an amino acid, and sometimes you need a vasodilator like niacin. Go ahead.
So what if, though, by age, right? You're talking about male menopause. At your age, your testosterone levels are normally lower.
They're normally lower, but you can increase them. Do you lift weights?
You can increase them, but with some of the bioidentical stuff, there's you can get the levels back up to much younger age.
Frank, why would you want to? Why would you want to? As long as you can, your body's working, you can create muscle mass, and you still have a libido that's strong for the person that you're with.
Yeah.
I kiddingly talked about Jack Welch. The point of it is, when you're young, 15 to 30, and you have high levels of testosterone in your body, you're going to be very aggressive. You're going to go out there and challenge the world. But, guys who are in their 60s and 70s still should be able to do what they want to do. If you get out and you lift weights, if you're eating properly, there are a lot of foods that will encourage that. But if you're eating traditional SAD diet, standard American diet, with all kinds of garbage in the food, like high levels of estrogenics in the food, then the pool of free testosterone that you have is not going to even be able to attach. It doesn't make any difference how much testosterone you're producing. It really has to do with how much you're actually going to transport into muscle, transport into the gonads for it to work. That's your free piece.
Right.
I
just think, at some level, though, that wouldn't you want to feel better and younger?
You can feel better.
Than your age.
You can feel great.
Yeah.
Frank, I'm in my 60s, okay?
Yeah.
And I can do anything that I want to do. I can function. I'm on the road constantly. I'm teaching. I'm training. I'm seeing patients. I'm going 24/7. I get away with very little sleep. It's because I take care of my body.
Right.
And if somebody's they're at a place where they can't function, it's because there's been a breakdown someplace. So where you start is by taking care of the things that are broken. Once you take care of the things that are broken, then there are herbs that will make you feel like Superman, using your testosterone to transport in. But you have to look at testosterone. You got to look at DHEA. Right. You have to look at the receptors that handle insulin and thyroid hormone and so forth. All of those are part of the same pattern.
And you'll go on a downhill slide too, because now your body won't make enough of the hormone it needs because it gets dependent, and then you go on a downhill spiral, becoming more and more dependent on it.
The more increase of hormone that you put into your body outside of what your body produces, you're going to increase your risk of cancer, you're going to increase your risk of heart disease, and other things that you don't want to deal with. It has to be in a natural balance with plenty of protective progesterone, which is produced in your adrenal system. So that whole fight-flight mechanism is where you start. And, we're happy to give you more information on it, but my opinion, just to start taking hormone replacement because without investigating the other pieces is not a good way to go.
Well, I certainly wouldn't do it unless I knew all the other aspects of what's going on with my body, all the other organ functions, what they're doing, what they're not doing, my adrenal.
Yeah, you're in Frederick. Do this. Send me a note, and there's a couple people out your way that do some good functional medicine work, and I'm happy to give you that referral.
Okay.
Frank, appreciate your phone call. Thank you for calling. That's the typical situation that we see, unfortunately, way too much of, that a guy was going to jump into taking testosterone because that's Fifth Avenue marketing.
Well, you also made a good mentioned a good comment about causing aggression. A lot of people want to take testosterone because they want better performance, but the performance aspect has other things going on, and then you increase your testosterone, you get aggression, but you don't get increased performance because of other issues. It's not a good thing.
No, it accumulates, it gets into the system again, and if you have way too much estrogen in the body, your testosterone is just going to sit there and it's going to form tumors.
Yeah.
And that's where you get into this catch-22. This Wednesday evening, 7:30 p.m. at the Roselle Center for Healing, Dr. Matthew Adams is going to be talking about uniquely male, or that thing about male menopause and transition. Be there. Listen, you're going to get our opinion. You don't have to accept it, but at least you're going to get the skinny some data on some things that you hadn't thought about and perhaps some things that you can do for yourself. Diana, thank you for calling. How can we help you?
Yes, hello. I saw on the computer a doctor talking about an FDA. I have ulcerative colitis. A doctor talking about an FDA-approved immune-supporting IV drug so that a rectal operation may not be necessary. Do you know anything about that?
There's a lot of. Is it something that is just new into treatment? Are they doing studies on it? I can't tell you. I've never seen it.
Yes.
Most ulcerative colitis options, have to do with different types of medications. There's aminosalicylates that they're using. An example is something called Pentasa. You've probably heard of that. Ascol. They're using treating very mild to moderate. But if you get into something that's you have high levels of inflammatory reaction, then they start using the steroids, things like Entecort and prednisone. They're heavier. There's immune modulators that they use. Some of the old drugs years ago have been taken off the marketplace because of the damage that they do. But other than the steroids, those things that suppress the immune system, those things that decrease inflammatory response, steroids, none of them are good long-term. What you have to do is you got to find out what's causing the colitis. Interestingly, one of my first patients many years ago, when I was an intern, was a young man who had ulcerative colitis and had literally 35 to 40 bowel movements a day, and they were all bloody and mucousy, and he had lost. This guy was about 6 foot. He was down to about 125, 126 pounds, and nobody, he'd been everywhere on all kinds of medications, and what worked for him, obviously, in those days, I didn't know anything compared to what I know today, is a dietary change had to be made that was significant. We put him on as organic as we could find for those days, and we kind of tested things. We took things out of his body, but we used acupuncture, and we used some things that would calm his system. We sent him out to do yoga and so forth. And as long as he did things perfectly, and by the time I left the clinic, the man had put back on 35 pounds. His bowel movements are no longer bloody. He was down at worst to some mucus and so forth.
That's like an autoimmune. I mean, your immune system's attacking itself. So just like we talk about with Hashimoto's or things autoimmune, you have to calm the immune system down by getting, gluten, other stuff out of your diet and things like that. Otherwise, your body's going to continue to attack its colon and destroy it.
And, in my opinion, there's so much more that can be done to calm that system down and to avoid surgery and so forth. Obviously, working hand in hand and watching it and making sure that things are progressing in a better fashion. But I don't know. I can't give you the information other than what I just gave you. If you send me a note. I mean, there's biological therapies. There's things like Remicade that comes to mind, and that what that does is it blocks certain types of amino acid transports within the body. But that's symptomatic resolution. So send me a note, Diana, or come by the office and talk to me. One or the other. But I'm happy to discuss this further for you. Really appreciate it. We got several more people there, so let's go to Levi, and we'll probably go over into the break. Levi, thank you for calling.
Yes, I'm 72 years old. I usually work out every day most of the time, but I notice that I've got a lot of nervous energy. I work 2 or 3 jobs. I referee soccer, and I work for the school, and I do some personal training. My question is, it seems like I went to the doctor with my testosterone because I noticed my muscle mass, I'm losing it. And also that my testosterone, the doctor gave me a gel, it doesn't work. Then they gave me some kind of pill to take, and I took it, and it seemed to give me headaches and other things.
Yeah, that's a side effect.
I started reading all these health books, and I went out and ordered some of those things. None of them worked.
No, they don't. So here, let me give you a quick bit. The gel is called Androgel, and it's a problem. By the way, anybody that's using a gel or anything like that, you can give your wife very high levels of testosterone because it gets on your bedclothes and your sheets and so forth.
I didn't know that.
Yeah, and she can have a problem because of that. Levi, I'm going to hold you over because I want to talk to you just a little bit more as we're coming up to the break. Just hang in there. Don't hang up. I'll get back to you as soon as we come back. We're talking about male menopause, which is Andropause. We're going to do a program this Wednesday evening called Uniquely Male.
Uniquely Male.
Uniquely Male in the office. We'll talk to you about that when we come back.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, The Special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, showing at the Angelica Film Center Mosaic in Fairfax, Virginia on Sunday, April 19th at 2 p.m. For tickets and more information, visit agelesshealthmovie.com.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live every Sunday, 12 noon, right on the spot that you have it set for right now. We're here to serve you. We're here to give you the most intimate and updated information on integrative and natural therapeutics as it relates to your problem. This Wednesday evening, Dr. Matthew Adams will be your host, your presenter at the Roselle Center for Healing. He's going to be talking about male menopause, andropause. The program's entitled Uniquely Male. See, I did it right that time.
Got it.
Okay, so if you'd like to attend, call us at 703-698-7117, 703-698-7117. And you can check up on any of the programs that we have on an ongoing basis in our practice by going to our website, rosellecare.com. That's ROSELLECARE.com. Levi, are you still hanging in there, buddy?
Yes, sir. I also had the hot and cold spells, too, I think I've had.
Yeah, that's typical male menopause transition that you're getting into. And for some guys, it happens very quickly. Some guys, it's slow over a period of time. But at the end of the day, the process is the same. So what you want to look at is, in your particular situation, what's been the triggering mechanism. This is truly one that you look at neurological communication from the brain spinal system. You look at biochemistry, the communication neurohormonally from one part of the body to the other, and you look at stress patterns. So here's what happens. Guy goes through life and, he puts up with things. We all do because we're men, right? So you put up with a little bit of pain here, a little bit of pain there. Pretty soon you learn to live with it. And it's always there, but it's a constant, insidious irritation. Now, if those nerves, like the ones that come from the low back, happen to go to the gonads, then just by fact that those nerves aren't firing the way they're supposed to, the gonads are not going to work. Biochemically, if you're not eating the things that you should be eating over time.
I try to eat the right things. That's what I really watch, too.
Okay, so that's a good thing, but here's the deal.
But I have arthritis pretty bad.
Well, it tells me that you've got an acidic body, that you can't have arthritic degeneration unless your system is acidic and unless your intestinal tract has been broken down, because the majority of your hormones and the way you absorb things come from that gut. So the intestinal system has to be looked at. Your fight-flight system, which is your adrenal glands, that has to be also supported and upregulated because that helps produce testosterone, estrogens, and progesterones, which we all have to have. So you have to look at it multidimensionally. It's not a simple answer. I do know that the simple answer is not medication. It's one that you have to look at. You can support it with herbs. I mean, from things like tribulus and maca and ginseng and so forth. There's a lot of things like that. Zinc, just sometimes increasing zinc at a very, very high level is enough to make that happen. But
if I came into your office, is it possible someone could help me in some way?
Oh, definitely.
Yeah, absolutely.
Yeah.
You know what I would tell you to do, Levi? Come to the program on Wednesday evening. It doesn't cost you a nickel, and you can talk to Dr. Matt, and he can talk to you individually after the program's over, and to see if it's something that you even want to get involved in. Love to have you as our guest. You know, we really appreciate it. Dr. Matt, let's talk a little bit about what the program's about. We don't have a lot of time. We got a little bit more than a minute. So, what are you going to cover this week?
Yeah, we're going to cover. Try to figure out why testosterone's low. We're going to talk about the other problems that go along with causing testosterone to be low, causing performance to be low. You know, the signs of if these things are happening, it's usually a worse thing going on in the body. We're going to talk about herbs that are going to support this, and I say support, not change it, but supportive while you're changing your body. We're going to talk about, all the stuff that we've been going on, all the questions that men are having about why they feel the way they do.
The unspoken questions.
Yeah, and then they can ask questions while we're talking. I mean, you come talk to me. We're just going to talk. We're going to have a good time. We're going to chat. Bring your questions, and we're going to figure out with everybody. Because if you have them, everybody else is going to have the same questions too.
Ladies, drag your husbands there. Call us at 703-698-7117, 703-698-7117. Kicking and screaming, get them there. I promised I was going to tell you a little bit of something at the end of the program today, so here's what's happening. Today in North Bethesda at the Marriott Hotel, it's on Marinelli Road, I am going to be lecturing at 2 o'clock at the Natural Living Expo. Be there. Love to have you. Love to meet you. Come over and say hello to me. Squeeze my hand, and we'll talk about whatever you want to talk about. I'll be hanging out for a while, so I'll see you there. As soon as I'm leaving here, I'm going there. You're listening to Dr. Tom Roselle Live. We're here every week, same old time, same old place. See you next week. Bye. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Hip and Knee Pain with Dr. Harlan Browning on Wednesday, April 1st at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.